I have a special guest with me today. I'm going to welcome back Laurie Dupar. Welcome back to the show, Laurie.
Thank you, Tara. I'm really excited to be here. Love doing your show with you.
I love having you as a guest. In just a moment, we're going to start talking about ADHD and the tipping points. But before that, Laurie, can you let the listeners know a bit about yourself, who you are in relationship to helping people affected by ADD and ADHD, and how they can get in contact with you after the show is ended?
Yeah, thanks, Tara. Like Tara said, my name is Laurie Dupar, and I'm a trained psychiatric mental health nurse practitioner, and I have been specializing in ADHD coaching now for just about 10 years. Love to work with people that are newly diagnosed with ADHD. It's sort of one of my passions with a background in that neurobiology, and helping them. One of the other, we're going to be talking about the tipping points today, but another area that I love to talk about and help people sort of maximize is their medications based on my experience and background as a nurse practitioner. You can get a hold of me, and I'd love to hear from you. My website is www.coachingforadhd.com, and that's all spelled out. Or you can email me if that's easier for you at support@coachingforadhd.com. Either way is great.
Thank you so much. And yeah, Laurie, you offer some great resources, so definitely take a look at her website. She has some great stuff, and the medication resources that you offer is great. And you're unique. You're one of the few people who's trained as an ADHD coach and a nurse practitioner. So, you have some great experience and great resources for people.
Yeah. It's funny how life works out. I was just writing someone this morning, or someone was asking me to do something for them, and they're sort of like, how did you get to what you're doing? And I said, you know what, I couldn't have planned it. Honestly, I would never have expected myself to be here, but I absolutely love what I do. So it's all worked out for the better, and I'm super glad that I can use my past experience in this current profession, because you and I both are very, very know how passionate we are about serving people with ADHD.
Okay, great. So we're going to be talking about the tipping points, or tipping point relationship to ADHD. So can you explain that a little bit to people before we get started actually talking about it?
Yeah. The tipping point is a term that I sort of came up with in the last couple of years. When we're talking with someone who, as a coach, we oftentimes get calls from someone who might have gone undiagnosed with ADHD, or even had been diagnosed with ADHD but managing it, and then for some reason something tips them over, is sort of what the sense was I got. And I just started to recognize that there were these similar situations, or similar, I guess, causative factors for these, what I call tipping points, when someone would go from either not being diagnosed with their ADHD and then being diagnosed, or that tipping point where all of a sudden the symptoms and challenges and struggles they were not managing as well, or they might have been diagnosed and managing it, and then they all of a sudden went, what happened? Things were going well, and it's just like, and that's literally how they described it, this point where it went from okay or even good to, oh my gosh, it's not working anymore, and completely dumbfounded. So, and what I discovered was that there was a lot of similar, I don't want to say causative factors or situations that people were in, tended to be part of what was causing sort of this tip over, as I call it, and understanding that and talking with people about that and sort of digging down a little bit deeper and discovering that for them was super helpful for them to be able to sort of go back and go, oh, okay, this is what was working, or to adjust for that new situation and then put in new strategies into effect. Because a lot of people, honestly, Tara, thought maybe they were just losing their mind. And that wasn't what it is.
And it's very common. I know, because I offer some support resources in the Women with ADHD site. We get a lot of people, on the forum writing in about that. They're like, okay, my life was going great. I was managing my ADHD, and all of a sudden, everything stopped working.
Yeah, the tipping point.
Yeah, that tipping point. And I don't think they really looked at or had anyone to help them say, okay, what is it that's going on? And like you said, there's different things that happen that, a lot of people have in common that,
Yeah, it's really fascinating. I'm sort of like a dog with a bone when it comes to things like this. Once I start to see sort of a pattern, and I can see, okay, this might be helpful, and having people, because what we know is that if there's a tipping point, there was a time when they were managing, things were going well. So we really want to build on those strengths, right? Seem to be really beneficial to go back and go, okay, so what changed? And sometimes that's environmental, sometimes it's physical, sometimes it's social is what happens. So some of the common denominators that I have started to find with regards to this tipping point is there may be changes, I guess you could say sort of generally in environment. someone's environment changed. And what's really fascinating is we think, the environment can be an academic environment. It's the student that did really well in third grade, and then they went into fourth grade and just completely fell apart. Mm-hmm. And looking at the environment, it may be simply the people that are in the class with them. It may be the teacher. It may be the change in school. So typical of, students going from one particular school situation to the next level, perhaps, grade school to junior high to high school to college. The environment itself may all of a sudden, it changes in a way that they're not able to compensate for it again. Perhaps like with high school or junior high, there's more need to switch around or change around. So it can be academic in that sense. And I think most people are sort of like, okay, well, that would make sense. Yes. It can also be environmental as far as work goes. So often I'm hearing people say that it is that they will have been doing great in a job, in fact, really wonderful in the job, that they will actually be promoted. And all of a sudden that what they didn't even realize where the supports were. Perhaps it was a coworker that really was sort of vigilant about time, that always kept them on time. Or they had someone else, or their office structure, the people that they shared the office with were fairly quiet, and now all of a sudden they got promoted, and then they're in a big room managing all these people based on their good work prior to that, but the environment completely sort of eroded that for them. Another situation that's sort of interesting is actually can be as simple as a home environment. I had a student I was working with, and again, doing really well through high school. It wasn't, but all of a sudden started to slip in his grades. So we're sort of looking at, the regular things like, is it a teacher? Is it the courses? What's going on? Something happening socially. What the tipping point for him was actually they had moved houses. And as I got to talk with him, what he would do in order to get ready to do his homework and sort of get out that extra energy is he would go in his backyard and pace. And as we were talking, he was like, I'd go in the backyard and pace. And so I'm thinking, so are you doing that now? Is that something you can bring back in? He goes, he had moved to a place where, and I live in California, and it's not uncommon to have rattlesnakes. And he was very afraid. They'd moved to a place where it backed up on like a reserve, and he was really afraid of a rattlesnake. He'd never told anybody that. He'd never put the two together, but basically what had happened is he'd lost that way that he was sort of preparing himself, getting his dopamine going in his brain by walking, sort of getting out his restlessness to sit down and do his homework because he couldn't go in the backyard and walk anymore. So it was isn't it? Yeah, amazing, right? So for him, that was the tipping point. And so we basically, of course, worked on how could he sort of bring that back into his life. He didn't go back and pace in the backyard, but some other way that he could use that physical activity. Yeah.
Wow.
Yeah.
Great he had you to help him, because the average person wouldn't think of that. So, wow.
Yeah, and this is what I mean. There's these tipping points that it's like, okay, if somebody's doing well, it's like, gosh, what changed? What was it that changed in your life, in your environment? So environment is very common. Another is relationships, and it's fascinating to me. Again, oftentimes I'll talk with folks, and it's they get married, and all of a sudden the way that they, right? I sort of heard you go, maybe a little comment, but they'll say, gosh, it was supposed to be really great, but perhaps their spouse is a little bit more of a neat-nick than they are. And so there's this extra pressure, and they're spending time doing, trying to clean a house or do something that they hadn't done before, and it's completely throwing them off sort of their mojo. That's very common. Having a baby, of course, we think, okay, well, that would make sense. There's extra work there, but sometimes it could be the second child. But that's very common. All of a sudden, bringing in a relative to maybe live with you, or an exchange student can also, what I call sort of that tipping point, or upset the apple cart a bit. Those are very common with relationships that happen. Another fascinating one is, I think it's what I call a physical tipping point. You said, I know, Terry, you work a lot with women and their ADD and ADHD, and hormonally, women around their 50s, when they're going through menopause, that hormonal imbalance, oftentimes, it's a physical sort of change in their body, will upset their management style that they've had before.
And it affects the medication too. Even just, women who aren't in menopause yet, once a month, when you get your period, you change. A lot of people say, oh, my medication stopped working. It's like, okay, talk to your doctor about it. And unfortunately, a lot of the doctors don't understand how much it affects the medication and the ADHD, the hormones and stuff.
Yeah, I don't think most people do, and in fact, I think that's when I work with women in that particular, around those particular hormonal issues, it is one of the most challenging areas, I think, the most challenged because they experience it so much. We know there's a correlation, and again, still trying to figure out what that is, but you're absolutely right. It could be on a monthly basis, and certainly during the menopausal years, it can really affect them. But in addition to that, a tipping point is often, and I started to sort of put my finger on this working, again, asking folks, so what changed? Or when were you doing well and what's different now?
Yeah.
Another very common one is a physical injury. Some sort of physical injury or change in your physical activity. I remember when I first was coaching and talking with a gentleman who actually was a river guide, and he loved what he did. He was outside, very physical, and he got injured. He was injured. His back was injured, so he wasn't able to do that. And prior to that, he knew he had some ADHD challenges, but was really managing very well. It wasn't to that point where it was a disorder and really affecting his life. And after the injury, recognizing that physical activity again was so important to him on so many levels because it increases that dopamine in our brain. Yeah. Oftentimes those physical activities also structure our lives. Work with a lot of college students who all of a sudden, academically, they just sort of start to dip, and it's like you just can't put your finger on it. It's not necessarily about the academics, but what we're noticing is academics for them. But looking back, a lot of these students have been high school athletes, and that structure, and I don't know if anyone listening probably has done high school athletics, but it's like every day, 2 or 3 hours a day, and on the weekend. Yeah. And that physical activity, again, we know, increases that dopamine in our brain, so it may be just enough to manage to add to the ability to focus and concentrate, help with the anxiety that people have, plus just make them feel good and sleep and all sorts of things. But a switch in physical activity, very, very common. And it's not something we typically are asking about. We're not asking what's the difference, what's making a difference, what's changed in your life.
So many things to look at. And a lot of times you need somebody asking you or triggering that question because the average person isn't going to think about that. And that it's that tipping point, which is that, small thing that, really affects it. Wow.
Yeah. Physically also, it's sort of fascinating. Again, I'm obviously very fascinated by this, but another sort of physical tipping point that I'll hear with people is, and they may not know it until looking back, but we know that dopamine is released also when we smoke cigarettes. And a lot of people will say that they just thought that it's one of the reasons why it's so hard to quit smoking if you are a smoker with ADHD, because it's not only the nicotine, that your body becomes accustomed to, but also that you are your body's releasing a little bit of dopamine at the same time. But they will oftentimes say that it's after they stopped smoking, they just felt like it was important on a health level, but somehow they knew it was helping them, but they didn't really understand what that was.
Oh, interesting. Yeah, I've talked to ex-smokers with ADHD, too, and they were saying, at work I had a built-in break, when I smoked. I'd get up away from my desk, go outside, whereas when they stopped smoking, they just sat at their desk for 8 hours straight or however long. So it's really interesting, not that, we should be advocating smoking or anything, but for somebody who is quitting smoking to keep, to make sure they have that break in there. Yeah. We're going outside and getting fresh air, or taking a walk, or going to the water cooler, or whatever else it is, and just to be aware that the nicotine, this stuff in the cigarettes does stimulate the brain also. So that was an interesting one. I had somebody, talk about that to me recently. Yeah,
I usually tell them, and so they don't typically want to go back to smoking. I mean, and but it's that physical getting up and moving around and giving their brain a break, because otherwise they won't. So what I tell them to do, Tara, I just tell them to drink a lot of water, because that tends to be socially acceptable. And if you're drinking a lot of water, you're going to have to get up to go to the bathroom more. So
yes.
It's built in. it's like, it's okay to drink a lot of water this day and age. It's healthy for us to do that.
Yeah.
So it's like, but it's like, okay, what was working as part of it was, of course, that extra dopamine that you're getting with that cigarette boost, but also that physical activity. Absolutely.
Yeah. Wow. Interesting.
Made a huge difference for folks. Or, some people who are, again, when we look at those other things like caffeine also increases our dopamine a bit. A lot of times people are sort of self-medicating with the caffeine before they even realize they have ADHD. And for, again, maybe health reasons or other reasons, they may try to decrease their caffeine and go, I don't know what was happening. So it's really like a bit of a sort of a treasure hunt to find out what is it that's changed for them, because if we can do that, oftentimes we can bring that back in some particular way, or at least know how they can, manage things a little bit differently, having that piece of information.
Yeah. Do you find traveling, just going on vacations, affects people? Would you call that a tipping point for some people?
Of course it is. Do you find that?
Yeah, I mean, that's one of the big things I people who just go on like a weekend vacation, a long weekend, it's really hard for them to get back on track, and because it changes their environment. And it's funny, there's some people that say, I love being away, everything's built in, the vacation's built in, the hotel, people cleaning for me, and then they come back, not only were they used to that, they have to get back into their regular day of life. And I found that too, and I know myself, you and I travel, a lot for our business, not a lot, but regularly, so I know with myself, I have to really prepare that when I come back, I have to make it an extra effort to get back into the swing of things and be proactive and be aware that it really can throw me off if I'm not paying attention to it.
Yeah, and I think for those, especially that, I think what's one of the things that, again, if we're looking at it on a physical basis, it's environmental too, absolutely. We get out of that routine, and we sometimes take that routine for granted. I think that how much that structure sort of helps us accomplish things during our days. But I also think when people travel, and I see this, it's also a tipping point I'll see, again, with college students more because now they have more of a ability to choose when they're going to sleep. And essentially, I think it's that change in sleep that truly triggers that. Again, our brain, when we're sleeping, only produces certain neurotransmitters, and starts to happen, I think, and oftentimes, especially if college students, it's one of the things that I'll ask people along with their exercise changes or their sleeping patterns, is when we change those sleeping patterns, it throws off the rest of the day, and it's a bit like we're jet lagged and we don't really take that into account if we're staying up late on weekends, that we're essentially jet lagging ourselves for the next 3 days until we try and get back on track, and then it's basically like we're jet lagging ourselves again when we stay up late or sleep in on the morning, and that can oftentimes definitely contribute to some of the tipping point. And is one thing to look at. It's like, have your sleep habits changed, or the time that you're sleeping has changed, because that can be such a support for setting that consistency in our day.
And I know, like, when I'm on a routine, I follow it very rigid, and it's just a little thing to throw me off. Like, it's funny, I'd fall asleep watching a certain TV show, and all of a sudden they changed the TV show. Like, it was like, I think it was Hallmark. I can't remember if it was Frasier, one of those old sitcoms I'd watch and fall asleep, and all of a sudden, from, like, November to after, December, they'd be showing all Christmas movies, and, like, that right there threw me off, and it's like, it's those little things that, and this year I'll prepare for it that, maybe I shouldn't even be watching TV before I fall asleep.
No,
but
whatever works.
It's amazing that those little things that you wouldn't think of, but, you as a coach might say, okay, Tara, what's going on? What changed? Oh, my TV show changed.
Yeah.
But it can really throw me off.
It can absolutely throw you off. And so, goes under sort of that environmental piece. We're using a strategy like watching TV or listening to something. We know it's like white noise in the background to help our brain sort of settle down, and then so we can fall asleep. So it's a great example if someone, again, if they've changed environments or something, even if they changes this programming show. I hadn't actually thought to ask that question, but I'm going to start doing it.
When my soaps went off the air, that really affected me. But it's those little, you really got me thinking. It's those little things, and people listening might be, might not be a TV show, but it might be something minor that has changed that could have really affected everything.
Yeah. Another key one that I find, and again, this goes back to environmental, and because there's so many, if we're looking at our environment, what changes? What was happening that was working for me that before the tipping point? And again, some people may have already been diagnosed, but they were managing it. And other people, the change may actually lead them to a diagnosis. But what was working beforehand, and over and over again, more, and you're much more technological savvy than I am, but over and over again, I will get calls from people who are really, really have been successful in their job, high-level jobs for years and years and years, and what has changed for them is that things have gone to the computer. And they can't touch it or feel some of those papers, have a sense of that in the same way. That is very commonly a tipping point for folks.
And they often change the interfaces of programs we use on a regular basis, like Gmail or Facebook, or like I had to upgrade my computer. I went from Windows 7 to Windows 8, and Windows 8 is very different, and it threw me off. So it's when you talk about technologies, it's those changes. Not only is it different, you have to relearn it, and that can throw you off too.
Yeah.
So it's amazing. The things that help us can also cause us frustration.
Yeah, some of the things that, and I think this is it, a lot of the things we don't even realize that we've been doing to help us, like you said, there's maybe a certain program that really worked, whatever it was that was working. And then you're right, for whatever reason, Google changes or Facebook changes, and it almost can set us into a panic, right? I don't know what to do anymore. But the same thing is very true. A lot of folks, it's that switch to environmentally in their job situations, that switch to technology. Those sorts of things can honestly be a tipping point for them, where again they were managing so well and very successful, and then, like I said, it's such a difference to know, it was a tipping point. I didn't just lose my mind. There's actually something going on here that I can go back and build on now that I know what's different in my life.
Yeah, and that's a big one, going from paper to having to do everything over the computer. And
absolutely.
Yeah, as a person with ADHD, I still do my planning on a notebook. I need to write pen and paper, and as you know, I'm a real tech person. So I could really, that would throw me off if someone said, okay, you can't write anything down anymore, you have to do it on the computer.
Right. Yeah. Oh, it absolutely is. I'm with you. I have I call it, for old-fashioned planner that I keep with me, and it has to be a certain size, and I'm sort of worried that my planner company is going to change the format of it, because it's really going to throw me off if it does. But yeah, that is, because I can see it and I can touch it, and that's what happens with the technology. Is it seems like a great idea, but like I said, physicians, attorneys, pharmacists who, because they're having to hold that information in their brain now and go back to where they have to put fill in the dots basically for a lot of their work. That is such a different experience for them than being able to flip through the pages or see. Okay, I have a stack of papers here. I know how many. I have to get done to be done for the day. When it's sort of this virtual, even a list that they can see on their computer, or it's not that same. It's a total change for how they have gauged that before, and they'll oftentimes misgauge that, and eventually it sort of catches up with them. So
I was just thinking, just like shopping, like it's products that I'll buy, all of a sudden they'll change the packaging, and just looking at that, it's like I get overwhelmed and almost go into a panic attack in the store, because it's like my feminine products, they change the box, and it's stuff like that. It's those minor things that, as a person with ADHD and, my other challenges, that can really set you off.
No, it really can. Again, I hadn't really thought about those particular things, but it's absolutely true. When something changes our environment, and we may not think about it, but it may be, how we have to drive home, or the certain car that we drive, we had no idea that because that one particular car had a clock on it, that was what was keeping us time, and now this new one, it is some sort of digital fancy thing, and I don't notice it as much. I mean, those are the types of things, and it's a lot like what you're saying. Sometimes improvement or advances in technology or product marketing it can really throw us off. And the good news is that, okay, if we can figure that out and go, okay, this is what it is, I haven't lost my mind, then we feel like, okay, there's much more of a sense of empowerment with that.
Bringing awareness to. I'm so glad you wanted to do this topic, because I think a lot of people listening are going to be able to relate to it and become more aware of the tipping points that are really affecting their lives and their ADHD.
Yeah. Well, and I like I said, love to be able to help people point this out. I think it's, again, something we may not be thinking about. Really a way just to sort of really recognize sometimes little things and sometimes big things can really make a difference in how we manage our ADHD, how we successfully manage it. And if we can figure out what changed, we can go back and go, oh, okay, this is what I need to put into place. And like that poor, that student who, he couldn't go back to walking in his backyard because there still was a legitimate fear for him, but he was able to take that and go, this is what was really helping me. And I don't remember what he ended up doing. I think he ended up putting some sort of like little mini trampoline in his room. He just needed that physical activity. But knowing that made him go, oh my gosh, it's not that I'm going to fail high school or never get into college, which is what his goal was. It's that I was doing something that worked for me, and I need to bring it back in.
Yeah, that's great.
Yeah.
We're actually getting towards the end of today's show, Laurie. Are there any final thoughts that you'd like to leave people with, or anything that you didn't mention today that you feel is important?
Oh my gosh, I'm sure there is, but I can't remember what it is now. I want to thank you for having me on the show. I love to come on the show, and I really encourage people, if they want to find out more about tipping points or what their tipping points are. Like I said, you can reach me at support@coachingforadhd.com, or you can go to my website at www.coachingforadhd.com.
Thank you so much, Laurie Dupar, and thank you, everybody, for listening to ADHD Support Talk. This is your host, Tara McGillicuddy. If you are listening on iTunes or another website, be sure to go to www.adhdsupporttalk.com, where you will find links to our guest websites and other important information. Thanks again, and have a great day.